Internal bruising of the neck structures. The soft tissues of the neck are compressed and forced upward and backward against the cervical vertebra. The bruise may be found in the dermis, in the superficial fascia, in the deep fascia, the muscles, the substance of the thyroid gland, sometimes under the capsules and in the substance of the submandibular gland. The bruises are usually separate in some cases. Bruising may be absent externally, although the deeper tissue may show fairly extensive bruising. Deeper tissue shows extensive bruising. Rarely there are no external or internal injuries. If the victim is unconscious and amount of pressure to the neck is minimal, the mark of the surface of the neck may not exactly correspond to the internal bruising because of the mobility of the skin, which may alter the relationship which normally existing between it and the underlying structure. The extent of the bruising, depending upon the degree of pressure used, in some cases a small area of bruising on either side of the midline, and usually over the thyroid cartilage or the hyoid bone may be the only fine. Sometimes some bruising of the muscle is very slight, and as such of the muscles of the neck should be dissected individually in situ. The tissues at the back of the neck may show bruising when counter pressure has been exerted. The muscles surrounding the larynx, both anterior and posteriorly, frequently show well-marked bruising. The sternocleidomastoid, deeper strap muscles may show patches and bleeding or even frank hematoma and may be torn. The platysma muscle may be bruised. And also, there may be deep hemorrhages in the neck tissue surrounding or adjacent to the bifurcation of the common carotid artery. The common carotid artery shows intimal tears in 10 to 15% of cases of the or near the carotid sinuses. So hemorrhages may occur in the pharynx, larynx, epiglottis, tonsil, base of the tongue, larynx immediately below the vocal cord and also beneath the capsules of the thyroid gland, parotid gland and some lymphatic glands of the anterior triangle of the neck. Deep hemorrhages may be found present in the base of the tongue, usually at the sides. Deep congestion is seen in a central or a whole posterior part of the tongue. The larynx is usually squeezed as the pressure is bilateral. To demonstrate the fracture of laryngeal cartilage, it is essential to strip the larynx of its attached muscles and ligaments. Minor fractures of the larynx may not be fatal. Bruises of the laryngeal mucosal membrane. The bruises of the laryngeal mucous membrane is frequent, sometimes accompanied by severe laryngeal swelling. Swelling which may or may not be accompanied by fracture of the hyoid bone or laryngeal cartilage. The surface of the epiglottis may shows shower of petechial hemorrhage or frank hemorrhages. The deep hemorrhages may be present in the base of the tongue. Lung shows a congestion with the subpleural hemorrhages or shows a petechial hemorrhage or frank hemorrhages. Deep hemorrhages may be found in the base of the tongue. Lung show congestion with the subpleural petechial hemorrhages, pulmonary edema, and the subpleural blebs may be present. A fine froth, blood stained, is present in the bronchi. Air passages may contain desquamated epithelial cells. Microscopically, the hemorrhages are seen in the interstices under the pleura and through rupture of the alveolar walls. Some areas are over distended with a ruptured alveoli and other areas are collapsed. The brain is usually congested and may show petechial hemorrhages in the white matter. Subarachnoid hemorrhages and rarely areas of the small hemorrhages in the brain may be present. Hemorrhages may be found in the brain. Other internal features are similar to that of strangulation. Thank you.